I look at myself as a general doctor. My training is in general medicine, and I'm a board certified internist, which means that I have to take care of adults primarily. So we see a few kids here and there. But what I was confronted with was poor job satisfaction. It was obvious to me that what I was doing was not working. My overweight people, they stayed overweight, and my diabetics stayed diabetic just to give them more medications, but they still be diabetic. It just never got better. I never saw a change in quality of life for my patients. You can imagine how this resulted in poor job satisfaction. I mean, think about it. If you were a florist and all the flowers you delivered were wilted and people got no pleasure out of them, how would you feel? Or say you were an engineer and you built bridges and all your bridges fell down. How would you feel? Well, I wasn't having any job satisfaction with the tools that I learned in my medical training. And by the way, one of the tools I did not learn was about food and diet. That was totally absent in my medical education. I mean, all I knew from my years of training was low salt and switching butter for margarine. That's all I learned in medical school. And students don't learn much more these days than what I had learned back then. So, I had a need, and that was to be the kind of doctor who helped people. It made a big difference. And because of what I'd seen on the sugar plantation, because I'd seen the difference in generations, my first generation people from the Philippines, Japan, China, and Korea, they were all trim. They didn't have breast cancer or prostate cancer or heart disease or diabetes. They were working hard into their 80s and 90s. My first generation living on a diet of rice and vegetables, no dairy, almost no meat. And then I saw the kids. They'd get a little fatter and a little sicker as they were exposed to the Western diet. The grandkids, they were unstoppable as far as poor health and physical abuse to their personal appearance. I mean, they were sick as any Americans. My third and fourth generation Filipino, Chinese, and Japanese plantation patients, their families. With that observation, I thought I had to come to the conclusion food must be important because I'm seeing this right there. And then I went back into training, and about that time, Mary and I were changing our diet and changing the diet of the children. And I discovered the medical library. Prior to that, I bet I'd read fewer than 6 scientific articles in my whole career. And I really had no interest at all. But boy, when I discovered the issue of food, I couldn't get enough. I went to the library and I found out that not only were the things that I observed by others, thousands of others, and highly respected people, but they had also observed that not only do you prevent illness with the right kind of food, the high blood pressure, the cancers, the heart disease, the diabetes, multiple sclerosis, etc. Not only do you prevent it, but if you stop throwing gasoline on the fire, then the body heals. Wow, what a tool. I saw this. I saw, previous people in other decades do these experiments. Yes, they were confined to a university or some obscure part of the world where nobody really heard much about them, but they did appear in the scientific literature. And I saw the work of many, many people, hundreds of people, that showed that you didn't just get your symptoms and signs covered up with a bunch of drugs. You didn't have to sit back and just give your patients a bunch of excuses. You could actually offer them a cure of their problem by fixing the cause of the problem, which is the food. It was so exciting. And I put this together. We started next giving lectures to both medical doctors and the community. And then these lectures and cooking classes that Mary and I did eventually led to a book. I took the lecture notes, the cooking class recipes, and we put together a book called Making the Change. It was a ring notebook. That was something we passed out in the office. Ring notebook so we could add new material to it, called Making the Change. It wasn't called, good food for a good body or heal and stay healthy. It was called Making the Change because we knew the problem would be getting people to change. It still is the most appropriate title out there of any books that I've written, Making the Change. Well, that eventually led to us putting together a book called the McDougall Plan. Found ourselves an agent. The agent sold the book to a very, very supportive company called New Century. And I went out on tour. They paid $10,000 for me to get a publicity agent to arrange various television, radio, and newspaper interviews around the country. So I went out in the country for 10 days, thinking that there were like 100,000 of my books in bookstores around the country. Thinking that I would sell that 100,000 books in just 10 days. Well, I got home after the 10 days and I asked, well, how many books did we sell? Well, the problem is, John, they told me that we didn't have very many books in the bookstore. We had fewer than 1,000 in all the bookstores in the whole country. In fact, we don't even have enough printed to meet all the sales of what you generated in 10 days. And I said to my publishers, I said, look, here, let's do a deal. I'm willing to work for free. You just have to pay for the airline tickets and the hotel rooms and any other expenses that I have. And as long as I come back and I say to you, did you make more money than you spent sending me out on tour? Then I'm going to go out on tour. And they agreed. So for the next 15 years, I went out on tour at my leisure. And I went all over the country, spent a tremendous amount of time away from the family, a week or two every month. And I sold the McDougall Plan, which led to another book and another book and another book. I had new things to write, new things to say, and eventually we put together the McDougall program in terms of books. Other highlight events were having St. Helena Hospital agree to me running a program at their hospital, a live-in program, and also running the resort program and getting involved. Mary and I have always been involved in it. I have to say one of the other big highlights is getting our daughter Heather involved 20 years ago. That was a slow learning process, but what do you expect? This is a complicated business to the point where now today she's basically running the program. I just appear on stage whenever I'm asked, do my song and dance. But it's been a tremendous experience. We've done some side businesses like the McDougall adventure trips. We've taken people all over North and South America and Hawaii, somewhere between 80 and 180 people. In fact, as many as 320 people were taken to different parts of the world. So we've done some amazing things. Produced a television show called McDougall MD, which played to 95% of the households over a period of about 6 years. Still plays today. A colorful career, to say the least, and one I've enjoyed tremendously.